More than 7 people have been confirmed to have the coronavirus in South Africa, and the Western Cape has been hit with the first case. The MEC for Health, Nomafrench Mbombo, and Alan Winde, who's the Premier of the Western Cape, will be briefing the media and giving us updates on the coronavirus and how people in the Western Cape should not panic and stay safe.
I mean, there's an international crisis which we know about, and the numbers keep increasing worldwide. And of late, the first case, as we know, is now coming to Cape Town. And it's not something we were not expecting. We were actually expecting that's going to happen, and we were prepared to react accordingly and respond accordingly. The important bit is to identify and then to mitigate the risk and to isolate it. And that's exactly what has happened. We've managed to isolate, and we're now starting the process of contact tracing, which means following up who that particular passenger or patient may have been in contact with over the last period of time, and then that is an ever-increasing number of people that we would contact trace.
Western Cape Premier Alan Winde said over 3,000 people had been tested for the virus in South Africa, and only a few tested positive.
These protocols and procedures have been in place for a while now in this country, and I want to commend them. We had a lot of international arrivals over the weekend where people came to take part in a bicycle race. It was interesting in the communication I was getting from people who'd been traveling around the world, saying they could not believe how professional, and it was actually better than they'd seen anywhere else, the kind of processes that we've got in place here as well. So I really want to commend the teams that have been out there for the last few weeks at our airports, at our ports, making sure that we're putting that first stage risk mitigation in place.
At the briefing, it was revealed that there are 3 people under quarantine at the Tygerberg Hospital receiving medical care. The doctor also added that South Africa was not experiencing a widespread outbreak of the virus.
We at the moment have 3 beds occupied, and all people are not very ill, but because we're in the containment phase, we decided to admit. Everybody cannot necessarily also self-isolate. So we're waiting those tests, and they should be available today.
Also want to just reiterate for a last time that if you, the citizen, feel that you feel a cold coming on, that doesn't mean you need to ask yourself the question, have I been in contact with international travelers? Have I traveled internationally? Then the next thing you must do is you mustn't all rush to your clinic. The next thing you should do is phone that hotline that the Minister spoke about. It is the hotline that will take you through a whole range of questions that would then say to you, please just quarantine yourself and monitor, or actually because you've been in contact in this area or whatever, they will advise you. That is an 0800 029 999. Say it again, 0800 029 999. If you yourself are worried, contact that call centre number. They will advise and help you.
MEC for Health, Nomafrench Mbombo, added that if anyone had been identified, they would have to be isolated and treated, and that Cape Townians shouldn't panic.
Don't be alarmists. We are creating these platforms so that you could be able to be on the alert. Again, do not panic, but be patient. We will always keep you informed about if any positive cases.
South Africa now has more than 14 cases confirmed, and the World Health Organization has declared the virus a pandemic. For our City News, I'm Edna Kangolo, Tygerberg Hospital.